Hello again, everyone. Mark Hack, Macomb County Executive. Deputy John Paul Rea, Deputy Executive here in the county, just kind of giving you an update on what's going on with COVID and preparations we're having for the vaccination, which we believe the vaccine's coming. So numbers are starting to kind of move down a little bit. And again, we still know COVID is amongst us and there is that community spread, but the numbers are starting to, I guess if you will, go in the right direction.
Mark, I think the communication that we've been getting out there, obviously working with the health department and our community partners with regards to the community spread and the impact that it's had, not only across the county, the state, and the nation and world over the past 6 weeks. I think people are taking those extra precautions, doing what they need to do to protect their families and loved ones, and I think more importantly, heeding the advice of those professionals of how they can put themselves in the best environment to weather this uptick that we've been going through. But as you highlighted, tremendous amount of excitement yesterday with the vaccines rolling out from Kalamazoo and their Pfizer facility there, the distribution network coming forward here, and hopefully we are here at the county to obtain the first doses of the vaccination here in Macomb County.
Yeah, and today was our first day with our new site, kind of an indoor testing site that we have at Baker College. It's on Gratiot south of 15. It's open to the public. Again, we know there's a lot of sites, macombgov.org. If you're looking for a place to go get tested, there's an icon you click on to understand where the test sites are. Baker College is our new test site. We're no longer doing it on North Rose over here in Mount Clemens. We are doing it at Baker College in Clinton Township. And again, great facility, great setup they have over there. Makes it simpler for people to kind of guide them through. And even with the staff here from our health department, they've done a wonderful job making people feel comfortable, making the actual experience comfortable. Although people don't like things being stuck up their nose. The way they do it, we've been getting great response from the public saying, they were very courteous and it wasn't painful. So again, the turnaround time on that is about 48 hours to get the test result coming back at you. But we're seeing the numbers of testing has gone down, so we are available. And if you want to just drive on up to that location, again, Monday through Friday, 9 to 3 is when you can go ahead and get that test. And I understand it's going pretty well so far, and I'm glad to hear that.
Yeah, successful first morning, Mark, as we're getting operations going. Clearly, we're going to have not only our health department team out there, got a tremendous amount of sports from facilities and operations. Obviously, the road department with regards to a little bit of serpentine when you get in the parking lot there, too. And our friends over at Clinton Township did a masterful job to expedite a lot of those building certifications that we needed to get our certificate of occupancy. So kudos to everyone. It was a light speed effort, and it's going to be a great facility for us and just illustrates the adaptability as we continue to respond to COVID.
Yeah, and as you mentioned, kind of this idea, what we're seeing here, we'll kind of explain that now that we talked about the test center, but the expediting of the vaccine, and now that Pfizer's got theirs rolled out, they begin the authorization by the FDA, the emergency authorization to get that out. It's rolling out of the plant. They're coming. We know we're going to get approximately 2,000, if you will, vials, doses here in Macomb County, specifically for the health department. But again, this has been designated. I think it's actually 1,950 is what we're looking at as far as our allotment. But it's been designated. The tiering process and what's been required by the federal government or standardized as well as the state, there's been specifics given. So in other words, the first round is going to be going to those that are in congregative care, nursing homes, as well as those people that are emergency workers, meaning EMS personnel. And so it doesn't mean firefighters, it doesn't mean police officers, it means those that are licensed EMS people here in Macomb County, of which we have about 1,800, maybe 2,000. So knowing that we have those numbers, and that's going to be our health department responsibility, we had to put our, I guess if you will, vaccination site together. We did that at the Verkulen building. It is very specific, meaning folks that are out there saying, am I going to be required if I'm an EMS worker to get one? There is no requirement from the federal government, state government, and or any licensing agency that we know about just yet. It's still voluntary. But also understand that if you aren't one of the people that have been identified to come and get the vaccine that we have available, don't show up to these sites because you're not going to get it. It's only specific to the EMS workers. We're working out that plan with them right now. So in other words, every fire agency, private, public, we're working with those folks to make a determination, those that want that vaccine, how do we schedule it so that we can do it? Because this is a very complicated, I guess, if you will, vaccine, this Pfizer vaccine, and there is a 2-dose process. And so there's a lot to deal with scheduling and making this happen. But I got to tell you, our folks at the Health Department, Emergency Management have done an incredible job of putting this site together and making it ready for when we start doing that vaccine. And we can do that within 24 hours after it arrives, once we have our plan together.
Mark, credit goes to the health department. We took an underutilized office space and now we have turned it into a healthcare facility that is going to be able to meet the demands of a vaccine that has been expedited beyond anyone's belief. And I think that's a credit not only to the healthcare professionals, but the folks that not only have had these strategies in place, but have practiced and are prepared for pandemics and challenges like this. I think the other great thing is, as you said, there's going to be a very very structured notification and certification process at the outset. So it's not one of those things where we're going to fly open the doors sometime this week and everyone can come on in. It's absolutely critical that you stay informed through macombgov.org, through those notifications that are come through the health department, and obviously through the video updates that you do throughout the week also.
Yeah, and once again, we're going to continue to give people that information, make sure they're fully aware of what's going on here in Macomb County, dealing with COVID. Macombgov.org is where you get your information. We are prepared as soon as we get that vaccine. We know we got the capacity to store it. In fact, we think we can help with the Pfizer vaccine, our northern counterparts, whether it's St. Clair, Sand Lake, Lapeer. We can help them if there's a need for us to store theirs. Already had that outreach and that working relationship with their health departments and their county board chairs, so we're very fortunate there. So again, you know, we keep telling people when it comes to this issue in and around our communities, you need to be aware of it. Social distance, wash your hands, and then obviously wearing of the mask really does help out. People know that, they're aware of that. We're fortunate numbers have gone down, but now knowing that the exciting part about the vaccine is here, I still tell people when they ask, you know, should I take it, should I not take it? This is something between you and your healthcare professional, your doctor. Have a conversation with them and your family members. Make that determination as to whether or not you should. Obviously, all indicators from those that are in the medical profession saying it's safe and it's something you probably should do. But rather than listening to someone who's a politician, I think we need to listen to the medical professionals to help guide us through this process so that you can make that informed decision yourself about your own health and well-being in taking this vaccination. We highly recommend people confer with their doctors and listen to the medical professionals.
Mark, even from the outset when there was concerns with regards to testing capacity and what course of action people should take, that was always one of the standard benchmarks. Always engage your healthcare professional because they will provide advice and counsel knowing the specific elements that you have with regards to your healthcare. Those types of blanket statements and stuff like that, we don't want to muddy the waters. That's where you can get the most critical information to impact you and your family.
All right, and so on that note, less serious if we can. JP and I talked a little bit beforehand. We always have these conversations. We never script anything. We just kind of come up with it and kind of throw it out there. But you know what? We were talking before, so we got to give it to the public now. You know, if they got kids at home.
All right, I'm going to go first.
I'm going to give my Christmas joke.
Okay.
Are you going to give yours? You give your Christmas
okay, I'll
joke.
go first.
You got to go these Christmas jokes, okay?
Mark, how much does Santa's sleigh cost?
I don't know. How much does Santa's sleigh cost?
Nothing. It's on the house.
Oh,
So that's pretty good?
I see what you did.
That's pretty good.
All right,
That's
I got one.
pretty
Here's
good.
mine.
Okay,
Here's
all
mine.
right, I'm ready.
All right, here's mine. What's the first thing an elf learns when they go to school?
I'm not sure.
The alphabet.
That's good.
Come on,
good.
that's the best we got.
That's
all
good.
right? So if you got kids, they'll probably work with them.
They will.
All right? But I thought that was kind of,
That's pretty good material.
I had my nephew laughing. It took him a while, but he finally started laughing
Yeah.
in the car. And when he did, I perpetuated his laugh.
There you
And
go.
when I got home, I told everybody, he laughed so hard, you have to your pants. Anyway, so with that being said, again, on a more serious note, continue to keep you and your family safe. And remember, check with macombgov.org as your information resource.